If you live, work, or just visit Elkhorn, chances are you've noticed it's booming.
Great places to eat, things to do, and more options when it comes to your health, like Skyline Vision Care.
Yeah, and Dr. Allison Walls is with Skyline Vision Care. Good to see you, Doctor. Thanks for coming in today.
Thank you. Thanks. Pleasure to be here.
Yeah, and we're going to be talking about all kinds of things involving our eyes and some of the services you provide. But I guess in general, are people taking as good of care as of their eyes as they should be?
You know, that's interesting. Everyone kind of thinks that you don't need to get your eyes checked unless you're having a problem seeing. That's not our belief. We check the whole health of the eye when you're coming in. So when you come in, not only are we checking to see if you can see well, basically we're looking for things like glaucoma. We're checking the vasculature in the back of the eye and the retina, looking for things like uncontrolled high blood pressure, high cholesterol, being diabetic. And then for children, the biggest thing that we're concerned about is eye teaming skills and accommodative things. Those things, if they go uncontrolled, basically it can affect reading, it can affect reading comprehension. So, it's not only all about seeing 20/20, it's really a true health check of the full eye.
Even for people that have great vision, how often should they be getting their eyes checked?
We do recommend yearly, especially over the age of 50. A lot more things are happening in the body, and those things can affect the vision as well.
Yeah, and then, some of the services you provide, I mean, you mentioned a lot of that stuff that you talked about. Even people that are having, they have fine vision, they should still be getting checked out. But talk about some of the services you provide. What do you treat? What type of conditions?
So obviously people that need glasses and contacts, that's kind of the well-known thing. But, we do treat glaucoma. We are a good provider for people that are diabetic that need to get a yearly eye exam. Also people with red eyes. So if you have allergies, dry eyes, you think you have pink eye, your kids have pink eye, we're the place to come, right? Yeah, yeah.
What sets your office apart from other practices?
So we really truly believe in our service. We think that we're trying to keep that small town feel of Elkhorn, where we know you, we know your family, we know what sports your kids play, we know what the hobbies are. So when you come in, it's a friendly face every time. We know our patients. And you just feel comfortable coming in, talking to us about any problems you're having.
Yeah, Skyline Vision Care. I live out in this area, and I've seen this district kind of take shape. And so you're new to that strip along 204th.
Correct.
Right there, right?
Yep.
And I guess one of the things that many of your patients require are frames. They need glasses, and they can get that right on the spot.
Correct, yeah. So we do have an in-office edger, which means if you are in single vision reading only, distance only, a lot of those we can cut same day. Or if not, if we don't have your prescription in stock, it's within the next day. If you require a bifocal or a progressive lens, we've partnered with some great labs in the area, so it's usually within a week, which is a great turnaround time for those type of lenses.
One of the things, we mentioned people that have good vision, but if they start to get our age, in the 40s, that reading does start to go. Is it important to get evaluated, even if you just need something like readers, to make sure that you're getting the right ones?
We do recommend that you come and check, because basically I've watched people in the drugstore. They're picking up frames, they're like holding things out. So, do I hold it here? Do I hold it here? Not all people's eyes are the same as well. So, you may be treating one eye correctly, the other one's off. The optical centers may not be a perfect fit for you. So it is a good idea. And I have no problem if the reading glasses over the counter are going to work great for you, that's not an issue. I mean, I will recommend that. I don't think people need to buy stuff. If they can go and get something over the counter, that's going to work just as well for them.
But when it comes to glasses that people wear on a daily basis, I've got two people in my family that wear glasses, and they always want these stylish glasses, right?
Correct,
So, I mean, there has to be something that people will like, that fits their style and their personality, and that's where the frame comes into play.
Right, so we have several designer frame lines that people recognize: Ray-Ban, Coach, Prada, Kate Spade, as well as some really good quality frame lines that maybe aren't so well known unless you're in the optical industry. One of those is called State Optical. They're out of Illinois. They're the only eyewear line in the entire U.S. that's made 100% in the U.S. So it's really cool stuff, really cool colors. Obviously you can go crazy wild, or we have some minimalist lines, so there's something for everybody and every price point as well.
Yeah, I think a lot of people have turned their glasses into their accessories.
Correct,
and they have some multiple pairs that they switch between. I have a couple too.
Yeah.
Insurance is a big concern for a lot of people, especially if they're looking for a new office, or maybe they need to get their kids in for the first time. What insurance plans do you accept?
So we are in network with the majority of the vision care plans, as well as major medical insurance as well. So if anyone has a question about vision insurance or vision plans, they can call our office. We're happy to help them look things up and see what their coverage would be, because I know that's a big thing.
Yeah, one of the things that I'm going to make an admission here on live TV, I have not taken good care of my eyes. I've noticed some changes, right?
Okay.
I've noticed a little bit of changes in my eyes, my vision. But people that I've talked to that get eye exams on a regular basis, at least, you know, on some offices, they talk about this puff of air.
Yes, everyone hates the puff of air.
Yeah, I hate the puff of air.
So, you know, it's checking the pressure in the back of the eye. It's one of the things that we're looking for when we're evaluating if someone has glaucoma. We actually do not do the puff of air in our office because we know how much everyone hates it. I hate it. I have contact lens wearer, I hate it. So what we have is we have a new machine where it has patented reflex technology. So there's no puff of air, there's no eye drops that are evaluated. You really don't feel it, and quite honestly, it's what veterinarians are using now to check the pressure in animal eyes.
You have a grand opening coming up. I believe it's a week from today.
A week from today, yeah,
What's
May 11th.
Planned?
So we're doing our ribbon cutting at 4. We are going to be there from 3 to 7, and we're going to have refreshments, appetizers, so many raffles, so many drawings for, you know, free eye exams, free pairs of glasses, free year supply of contact lenses. In addition, a lot of the local businesses have kind of chipped in. We're having gift cards for them, so should be a good time. Come out and meet us, come meet our staff, and check out our space, our glasses, and see what you think.
And you've got a special offer for Morning Blend viewers. You can save 20% off glasses. So what do people need to know about it? Do they have to be patients, or?
They do not have to be patients. If they do not have a current prescription, you know, we can always do eye exams for them. If they have a current prescription, obviously they can use that, and then they'll receive 20% off the glasses.
And how long is that offer good for?
We're going to offer it through May.
Well, through May. Do you have to mention Morning Blend?
Mention Morning Blend so we know your viewers,
just say
right?
Morning Blend.
Right.
Doctor, thanks for coming in this morning.
Thank you. I appreciate it.
Congratulations
Vision
and
Care,
good luck.
Thank you. Thanks.
I'd go see her.
Well, yeah.
Like half blind. Yesterday.